Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer, A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a presentation by Dr. Leena Rao on gut microbiome. You now have 90 seconds to read the questions.
My name's Dr. Leena Rao, and my presentation is about the gut microbiome, an incredibly dynamic and increasingly important area of medicine. And that probably explains why, among our patients, there's a lot of confusion about what the microbiome actually is, how it functions, and why it matters for overall health. To my mind, this confusion stems from the explosion of wellness trends and commercial products that often oversimplify or misrepresent the science. As clinicians, we need to explain what the gut microbiome really is, in clear terms, and why it's vital to human health, starting with the fundamentals. Of course, there is a need for more scientific research on gut microbiology. The gut microbiome refers to the trillions of microorganisms, bacteria, viruses, fungi, and other microbes that live in the digestive tract, primarily the colon. These microbes aren't just passive residents. They play active roles in digestion, immune regulation, vitamin production, and even mood regulation through the gut-brain axis. But when the balance of these microbes is disrupted due to poor diet, antibiotics, stress, or illness, it can lead to a condition known as dysbiosis. Dysbiosis has been linked to a wide range of health issues, from irritable bowel syndrome and obesity to autoimmune diseases and depression. We often explain to patients that not all bacteria are harmful. In fact, many are essential for breaking down fiber, producing short-chain fatty acids, and protecting against pathogens. Using terms like good and bad bacteria can help patients grasp the concept, even though the reality is more nuanced. We also emphasize that diversity is key. A healthy gut microbiome contains a wide variety of microbial species. Tests like stool analysis and microbiome sequencing can help us understand a patient's microbial profile and guide dietary or therapeutic interventions. One of the challenges we face is that patients often look for quick fixes, like probiotic supplements, without addressing the root causes of imbalance. They may not realize that the microbiome is shaped over time by long-term dietary patterns, antibiotic use, and lifestyle factors. That's why we stress the importance of a fiber-rich, plant-based diet, which feeds beneficial microbes and promotes microbial diversity. Fermented foods like yogurt, kefir, kimchi, and sauerkraut can also help introduce beneficial bacteria. But we caution against over-reliance on commercial probiotics, which may not be tailored to individual needs and often lack scientific validation. Preventive medicine plays a crucial role in maintaining gut health. We now know that early life factors, such as mode of birth, breastfeeding, and early antibiotic exposure can influence microbiome development. This makes it especially important to educate parents and caregivers about the long-term impact of these early decisions. In adults, chronic stress, lack of sleep, and sedentary behavior can all negatively affect the microbiome. That's why we encourage patients to take a holistic approach, focusing not just on diet, but also on stress management, physical activity, and sleep hygiene. In terms of treatment, we're seeing exciting developments in microbiome-targeted therapies. Fecal microbiota transplantation, FMT, for example, has shown remarkable success in treating recurrent Clostridioides difficile infections by restoring microbial balance. Researchers are also exploring precision probiotics, engineered strains designed to perform specific functions, such as reducing inflammation or improving insulin sensitivity. Another promising area is postbiotics, metabolites produced by beneficial microbes that may offer therapeutic benefits without introducing live organisms. These innovations could revolutionize how we treat not only gastrointestinal disorders but also metabolic, neurological, and autoimmune conditions. Looking ahead, the future of microbiome medicine lies in personalization. As we learn more about how individual microbiomes differ, we'll be able to tailor interventions based on a person's unique microbial profile. This could include personalized nutrition plans, targeted microbial therapies, and even microbiome-based diagnostics. But for now, our most powerful tools remain education, prevention, and lifestyle modification, helping patients understand that nurturing their gut microbiome is one of the most impactful things they can do for their overall health.